What inspired you to get into public health?
Someone that I knew was in the industry invited me and said, hey, can you help me build my business? At that time, I knew nothing about healthcare. I didn't even have health insurance. But I took the meeting and I started to realize the amount of problems there was in healthcare. I quickly started to identify the money flow from the government down and everyone that was involved and how everyone benefited from it financially and where some of those gaps were. And one thing led to another, where I started to see there could be an impact here in a way for us to build a business, make good money, but more importantly, actually be able to help people. And that's what really has driven me the entire time to not only build a company, but to stay in healthcare. Working with federal qualified health centers is what's really driven me even more. When I started 15 years ago, that wasn't the case. I was working with IPAs and medical groups. But about 8 years ago, when I started to really learn more about FQHCs and how them being the most underserved organizations that serve the underserved communities, I felt that there was a need and a calling for me there. And I feel good about the work that we do every single day.